Thank you. Good morning, everybody. I'm Francois Salin from Ilasis. We're located in Bordeaux, in France, and I'm going to talk today about our solution for automated laser capsulotomy based on frugal innovation. As you all know, capsulotomy is the most tricky, and as Pavel said, most tricky part of the cataract surgery. About 10 years ago, the introduction of femtolaser made it possible to provide perfect and with little risk capsulorhexis, but at the expense of non-acceptable cost and complexity. Starting from this observation, David Touboul from Bordeaux introduced the idea of developing a very simple femtolaser exclusively focused on the perfect capsulotomy. So we created Ilasis in 2019 to bring this idea on the market based on the 35 years of femtosecond technology experience we have and on frugal innovation, which is a very strong concept. Our solution to make capsulorhexis simple and affordable relies on a strong and disruptive innovation. We just replace fully robotized system by a surgeon with a very smart tool. Our tool is in fact a femtolaser blade with no adjustment, works on all patients, and is purely driven by the surgeon. We try to help the surgeon, not to replace him. Ilasis has developed and patented a unique femtosecond laser that's a fiber delivered to a handpiece. It does the cut, the rhexis, within about 20 milliseconds. It is battery powered. You can roll it from room to room. And although it has all the performances of classical femtosecond lasers, it costs a very small fraction of the cost of a flax. We are in the clinical trials. We're doing them in Nantes, in France, with Dr. Lignereux. Already have 30 patients treated. We can see that the rhexis is perfectly round, smooth, and well-centered. I'm going to show you a quick video, real time, where you see Dr. Lignereux proceeding. He puts an interface, patient interface on the eye, and grab the hand tools, put it on the eye, and then when it's ready, he has centered the piece. You just press the pedal and shoot the laser. And voila, it's done. 4 seconds later, I can just proceed with the usual workflow of his cataract procedures. Ilasis roadmap is pretty simple. We already secured all the schedule for CE marking with our notified body. So we hope to get it in September 2023. FDA approval is on track also, and we should get the FDA approval a few months later. And we hope to be on the market in September 2023. So please come and see us at ESCRS in Vienna to be the first one to be able to perform perfect rhexis at a fraction of the cost of a flax system. Thank you very much.
So Pavel, again, can you comment on this?
Okay, so I think that's exactly what the market needs, what we need. You know, as perfect as possible rhexis at a fraction of time, at a fraction of cost, which would be affordable to most of us. So congratulate that. I really welcome. That's another laser. It's a second laser which only performs capsulotomy to best of my knowledge. You already mentioned the challenge with centration. So again, there is a new method according to that Tripand landmark, which might be also applicable for this method. My question is, can you visualize that? How do you see that on the screen? What's happening there, or is it just blind?
It's a standalone system, so you can visualize where your cut is going to be done through a kind of optical setup in the system itself. So we don't need any kind of microscope, but you have it's not a microscope, but it's a lens in the system. So you can really see it. We have a target just to center it exactly where you want. And as has been said, optical axis, nobody knows where it is. So you need to center it to something else, which is what you do in general. So you can do it manually, of course. And it's standalone, so no microscope needed.
Regarding the affordability, the key question from my side, are you going to implement per click fee, or is it going to be just you sell the machine?
That's a very good question. as you know, companies need to make money sooner or later. So we'll have to find a way so you can be happy and we can be happy. Whether it's click fee or not, we'll see.
Good proposal.
Okay, if we may wrap up then this session, what we have seen is some very nice innovations, some in logistics like bilateral cataract surgery, some in real new technology. We've addressed some of the cost effectiveness issues and also reimbursement issues on these methodologies. And I think the last one was also pretty nice because I thought you were going to make a smoothie actually when I saw the machine. But you know, this brings us to one step further, I think. Integration of femto technology into a phaco machine and combine it, because that's what we are waiting for. You only have to do something about the price, I think, in the future, and then it will be implemented in Europe.
To include both in the same machine, well, you see it's the same size, it works the same way, it's manual. So I don't see any problem in integrating a phaco, except I don't know how to make a phaco, so we need to team up with someone. But no problem.
Our nurses want one machine, Francois. Okay, well, thank you very much all for your presentations. Very nice.